I oversee employment. Navigation. And I just want to give a little plug for employment navigation. A lot of providers or folks here, employment navigator, and they're thinking community integrated employment. Obviously, yes, that is our goal. But what employment navigators can do is come be a part of the team. And we do have some partnerships directly with providers where we have an employment navigator supporting them directly. And we help build that meaningful path to employment. So whether someone's in ADS or vocab or group employment, we're in there helping. And we also have children's employment navigators, so we can help teams and providers who are supporting residentially youth 14 and up attending their school meetings to help build that transition path of employment into adult life. But thank you for joining us for helping providers get started with community ADS VH services. And I would like to introduce our first presenter is Erin Mayer, the Assistant Director of Service and Support Administration.
Good morning, everybody.
Good morning.
Jen, you're doing the slides, is that right? Okay. Okay, so I'm going to talk a little bit about adult day services and vocational habilitation and the rules and the addition of this community integrated service. So a community integrated setting is what we're talking about today. And so the rule does define what that is. It is a setting that is integrated, which means it's alongside people that don't have disabilities in the community, where individuals have the same opportunity to access the community as anyone else. So these are public places and spaces where all of the community may gather or go or be engaged. And so those are the types of settings that we're talking about. The rule of adult day support and vocational habilitation has not changed. There's been a little bit of confusion about what this community integrated means because we've been kind of going through a series of things. So if any of you have been around for a little bit, at one point there was a community integration add-on that providers could utilize by going out in small groups and bill an add-on rate. And then during the pandemic, they started what was called STEP services. And this new community integrated service is kind of combining and replacing both of those things. So I know I've gotten some feedback when we're talking about community integrated ADS or VH. They're like, I don't know what that is. We're talking about the same thing as the community integration add-on and what STEP services was. This is just the new way we're going to be moving forward with authorizing and billing services. And the intent, which is what we've been talking about for a long time, is really to move from facility-based services and settings into more community-based engaged settings. Jen, you can go to the next slide. Okay, so first we're going to talk about adult day support. And when we talk about adult day support, this means that we're not talking about employment, we're not talking about work, we're not talking about vocational services at all. So when we talk about something that would be adult day services in the community, this may be recreation and group activities that are considered therapeutic in nature. So there needs to be a purpose to the service. I know Sarah's going to talk later about some examples, but I know I've had SSAs ask me, well, what if they go to McDonald's, or what if they want to go to a Mud Hens game? It's all going to come back to what is the purpose of that service. It should be to meet the individual's identified outcomes and support needs, in addition to ensuring that it meets the definition of the rule, which is that the service should contribute to, and it doesn't have to be all of these things, but it needs to touch one of these things: independence building, self-advocacy, social integration with a larger community, and community membership and engagement. So when we're looking at the activities that would be considered community integrated adult day service, it needs to have a foundation in one of those themes. Also, the purpose is to assist the person to maintain their maximum potential. And like I said, all of these services and supports and outcomes will be identified in the individual's plan, and it's going to look different for each person. These are individualized services. That's why they're going out in small groups of 4 or less. So you'll need to review the ISP and see what those assessed needs are and how that service can meet the need that's been identified by the team. Next slide. Okay, so now we're going to talk about vocational habilitation. Are other people having problems with the sound? Okay.
No.
So vocational habilitation is where we're talking about building those vocational skills, employment skills, with the goal of working towards future of integrated competitive employment. So when we're talking about community integrated vocational habilitation, this could be experiential learning and work experiences in a community-based setting. Again, these are in public places and spaces alongside non-disabled peers and community members. The purpose of vocational habilitation is to obtain general work skills, explore career options, and address specific barriers that have been identified for the person to support them to move forward on their path to employment. So one example, I think I have this more on later slides too. So an example could be volunteering somewhere in the community, like a food pantry, where there's public interaction and they're working on those general work skills. So through the volunteer opportunity, they're working on general work skills, maybe how to engage with their coworkers and peers, how to respond to direction, staying on task, general attendance, any of those general things that are going to further their ability to be employed. We're not talking about learning a specific job task. So we're not training on a particular skill set like janitorial or stocking, things of that nature. It's about general transferable skills. And that is the case with vocational habilitation, whether it's done in a facility-based setting or a community-based setting. And as I stated, the services need to be purposeful and individualized and contribute towards their outcome of future community integrated employment. Next slide. Okay, so these are just some examples of things we kind of know what's that are going on now. Like I said, Sarah will share more about what her program's doing at RVI. But so for adult day services, it could be going out shopping, completing transactions. That's going to be that independent skill building to help them be more independent in their personal life. Going out to a restaurant to develop social skills, participating in activities at a metro park that again are open to the larger community. And then volunteering. I have volunteering on both slides. That's a huge one that comes up. And again, I want to say that we're looking at what is the intent of the service. So if they are volunteering to give back to their community, to engage with their community, to build those relationships, that is an adult day services community integrated service. Jen, if you want to go to the next slide, I'll kind of skip ahead here. So then we've got volunteering also for vocational habilitation. If we're engaging in volunteering for vocational habilitation, the purpose is, like I said on the other slide, to build those general work skills. So you could have a group of individuals that are going to the same volunteer site and engaging in a volunteer activity for two distinct purposes. One may be doing it just to have that community engagement, and the other may be doing it to build work skills. So again, it's really about the individual's assessed need rather than the setting. Some other examples about how vocational habilitation community integrated could be done is going out to tour various job sites and employers to see what kinds of careers are out there, various job training programs in the community. So there's different things through Owens and Penta that are available to adults. There's different, all kinds of different training opportunities out there. So learning more about that, exposing them to that so that they can see what those next steps might be to address the barriers that they may have or concerns they may have about moving into employment. And those are all done again in a community-based setting. Next slide. Okay, so this is what we in the SSA department have been talking a lot about, and I know there's a few providers that are on the call that are already starting to work towards providing these services. So when we are determining whether or not this service is going to be provided, again, it's based on the assessed need for the individual. So that is something that the SSA and the team is going to be determining together. Does this person have a need for this service? And well, does this person have a need? And will this service meet that need? That's the first thing we're going to talk about. And then if it is, and we decide that we're going to authorize that service, we as SSAs are required by rule to offer free choice of provider. So even though they may be attending a particular ADS or vocational habilitation program currently, and we identified the need for community integrated services, does not mean necessarily that that same provider would be the one to provide that community integrated service. It needs to be a discussion with the individual and team about the options that are available and the different providers that offer that service, and then they make that choice which provider they want to utilize. So it's not just a given that because even the service is needed that we're going to go with the provider that that they're already using. The individuals make that choice along with their guardian and team. I already talked about the assessed need. So once we've determined the assessed need and we identify the provider that is going to have that, the next step is to hold a team meeting. So these aren't things that we're going to be doing over a phone call. We need to have a team meeting to discuss specifically what services and supports and outcome action steps are needed to meet the assessed need that we've identified. And then that needs to be written into the plan. So then we need to either amend the plan, or if it's time for the annual plan, when those things are being discussed, the SSA is going to implement all of those new services and supports into the plan and send that out to the team for review and agreement. And at that point, services can be implemented. So it is a process. Like I said, it's not just a phone call like, hey, we hear we can build this service. Can you go ahead and authorize it? We need to make sure there's an assessed need, determine the provider, and then amend the plan. Is there another slide, or I'm not sure where I'm done here, Jen? Okay, yeah. So just a few more things to consider. This actually came off some guidance that was provided by the state. So these are questions for the team. And this goes into a little bit more about the provider end about it. So when we're looking at these services, how is transportation to the community location going to occur? Is the participation in the community activity the person's choice? Again, it should be individualized to the person. These should be not predetermined activities set by the staff based off of some calendar that somebody came up with. It should be specific to their supports and outcomes. Somebody may have a goal to learn more about gardening. Now that's individualized to that person, but there may be aspects of someone else's goal that can be linked together for them to participate in that activity together. So it's not always going to be just what one person wants, because we are talking about small groups, but the activities should be customized to the people that you're serving and what their interests and needs are. Again, is the community activity naturally occurring in the environment? So we're not talking about setting up, having the metro parks come and just talk to our small group of people, or going to the zoo for an isolated activity. This is participating in programs and community businesses that are already naturally occurring, where they have the opportunity to integrate and access and have communication with the larger community members. And that also goes into number 4 and 5. So it can't just be specific to people with disabilities. It needs to be open to everybody. And are there accommodations for people with complex physical, behavioral, medical needs? So that's something that needs to be considered. We obviously need to always ensure health and safety, as well as ensuring that we're providing the services. So assessing those environments that you're going to be going into and making sure that not only are they meeting the needs according to the plan, but that those are going to be safe activities for the person.
Well, thank you, Erin. Does anyone have any questions for Erin at this time? We are going to talk about billing and a provider's experience, but does anyone have any questions for Erin? All right. Well, then next up is Rita Chamberlain, and she is the Medicaid Provider Support Manager for the Lucas County Board of DD.
Hey, hello, everyone. Hopefully you can hear me. So I get to talk about the fun stuff related to the billing. So just a few things in general. To bill the integrated community ADS or the integrated community vocab, there is the required group size of 4 or fewer individuals. So that would be 4 individuals with 1 staff. And if the group size happens to be more than 4 individuals, the billing for that particular session or that particular day would be required to be at the regular assessed acuity level. So, you know, not to say that it can't happen to these larger groups, but in order to be able to bill for it, it's got to be at that group size of 4 or less. The same provider cannot bill both a daily rate and a 15-minute billing units on the same for the same individual on the same day. So if you're providing either one of these services, those of you that do billing, you know that a daily rate is when your services are between 5 and 7 hours of that day for the individual of the same type service. So if a provider had a day program and that day program was a 6-hour day program, and they're going to do 5 hours of ADS, regular traditional ADS in the facility, and then they're going to do an hour of the community integrated setting, you can't bill a daily rate for the regular day program and then bill 15 minutes for the community. You're going to have to then bill 15 minutes for both of those services in that day. The billing code submitted must be billed specific to the service delivery type for that day. So if you're providing ADS, you got to bill it as ADS. If you're providing vocab, you got to bill it as vocab. If you're doing a combination of both of those, you're going to have to break it out and bill, you know, specific how many hours were ADS and how many hours were vocab. That's going to be for your traditional ADS and facility or a regular vocab and facility, as well as the community services that are delivered to. There is the ability to bill the behavior or medical modification rate. However, that does require you to do 15-minute billing regardless. So it doesn't matter how many hours of service it is. You do have to do the 15-minute billing for that day. The modified rate is only permitted though if the individual first qualifies for the service and the provider has elected to receive this. So a little different from homemaker personal care services, if the day program provider wants to bill the medical add-on or the behavioral add-on, assuming the individual qualifies for either of those add-ons, they need to make sure to tell the SAS that they are choosing to bill that add-on, and it needs to be identified in the ISP. And then once it's identified in the ISP, here in Lucas, the service and support specialist will let us know that the provider intends to bill it, and then we'll work it up in a way that physically lets you bill it. Now, this also goes for just your regular in-facility services too. You need to keep in mind though, if you do elect to bill the behavior or the medical add-on, it's going to depend on how many days or how many hours of service that you provide in a day. And you have to kind of factor it out, because some will find that if you're, let's say, a 5-hour day program, so your program's only open 5 hours, the individual qualifies for the behavior add-on. When you look at the 15-minute rate for that day program, whether it's the community or not in the community, either location, you're going to take that base rate of that 15-minute rate and you're going to add the 63-cent add-on that goes along with it. If they qualify and you elect to bill it, well, then if you take that and multiply it times 5 hours, you're going to find that your actual amount that you're going to get that day, if the person would be otherwise billed at a full daily rate that day, it would be actually bringing in less money. So a lot of providers, if their day program is like 5.5 hour day, they choose not to bill it because you actually could lose money. Again, that's when it's based off the daily rate. And the reason for that is when a daily rate is appropriate to be billed, that daily rate is equivalent to 6.25 hours. So when you take that rate of a daily rate and you multiply it out by what the rate is, the daily rate multiplied what the unit rate is, it comes out to that 6.25 hours. So you could have a 5-hour day program, but when you're billing a daily rate, you're getting more than what you would get if you were 15-minute billing it. So, and if this gets a little bit confusing, you can always reach out to me and I can explain it. We can look at your specific situation, but you don't want to elect to bill it if it's going to hurt you financially. So that's just something to keep in mind. The other thing is that the cost of doing business rate, so the services have a different rate based off of the county cost of doing business, and that's not going to be where the individual's waivers from. So the individual could live in Lucas County, but if they're going to do any type of community ADS, community vocab, or even in facility services in another county, you have to bill it based off the county where the service is delivered. So as an example, I'm going to use Sarah here for example. They're out of really Ottawa County, right? Okay, so you're out of Ottawa County, and they have individuals that do Lucas County activities. So their service itself is being delivered in Lucas. So they're going to bill it at a Lucas rate, even though the provider's from Ottawa County, because they're delivering that service in Lucas. But if they decide today they're going to have an activity where they're going to go into Ottawa County and they're going to be providing that service in Ottawa County, they got to bill it at the Ottawa County rate. Now, that happens to be the same rate as Lucas, but you have to bill it based off of where that is. So we have some providers that provide the services in Fulton County. They'd have to bill the Fulton County rate because that's where the service is delivered. So you just want to make sure that you're looking to see what the cost of doing business category is for the particular county where the service is delivered. So you can go ahead and move on, Jennifer. Okay, so when you're billing community ADS, the integrated community ADS, you could bill it two different ways. It could be a daily billing rate unit, which that's going to be when that delivery of that integrated community ADS, so that entire service for the whole day was between 5 and 7 hours for the individual on that calendar day. And the individual does not qualify, or the provider elects not to receive the behavioral medical add-on modification rate, or the community integration ADS is the community ADS needs to be the only mode of service delivered on that day. So it's not a combination of in the facility for part of the day, then out in the community for part of the day, or it's not a matter of community ADS for part of the day and community vocab for part of the day. It's got to be that entire service of the day is community ADS. And then if all of those things meet criteria, then you can go in and bill the daily rate. And so you may, again, this is where you may have a 5-hour day program, but if you're able to bill the daily rate because it meets criteria, you're actually going to get paid for what's equivalent to a 6.25-hour day. Now, to bill that, you do need to make sure that you're using the right codes, because if you don't use the right codes, if you just bill it as a traditional ADS service, you're going to get paid the traditional ADS rate. So you want to make sure that you're billing the right rate. And I've got them listed there, what the rate is for the IO waiver, the level 1 waiver, and the self waiver. The key to it is your last 2 digits are DU. The first letter of the billing code is always the type of waiver that the individual has. So those of you that do billing, you know, if somebody's an IO waiver, it always starts with an A. A level 1 waiver always starts with an F. But the DU, the D means that it's that community integration ADS, and then that U is going to be that it's a daily unit. And then again, I put on here what the rates are for the different cost of doing business categories. So if that service is being delivered in Lucas and Ottawa County, your daily rate is going to be $128.25. If it's Wood or Fulton County, your rate's going to be $126.75. So you can see it's a little bit different on the smaller counties. Okay, you can go ahead and go to the next slide, Jennifer. Now, the flip side of the billing is going to be if it's a 15-minute billing. So you could have, if it doesn't meet criteria for the daily rate, then you're going to have to bill the services at the 15-minute billing rate. So this would apply when the provider delivers less than 5 hours or more than 7 hours of service to that individual on the calendar day. If the individual qualifies for and the provider elects to bill the behavioral medical add-on, you're going to have to bill it 15 minutes. Or if the services provided to the individual are in multiple modes on that same day. So if you provide part of the day in the facility, and then you're going to go out for a couple hours of your community day services, you're going to have to bill both of those services for the day at the 15-minute rate. The codes here are a little bit different then. You still got the A, the F, and the S as far as what your service code starts with. The D is going to be for the meaning that it's out in the community, and then the T is going to be that it's the 15-minute rate. So ADT, FDT, or SDT. And then again, I put on here what the different rates are for the different cost of doing business categories. So Lucas and Ottawa, you'd be looking at $5.13 per unit, whereas Wood or Fulton County is going to be a little bit less, and they would be $5.07 per unit. You can go ahead to the next slide. So now on the community voc habilitation, again, you've got a daily rate. And so with that, it's going to be the same as what you would see in the adult day support one. It's going to be that your services are between 5 and 7 hours for that calendar day, and the individual doesn't qualify, or you don't elect to bill for the behavioral medical add-on. And then that community integrated community vocab is the only mode of service that's delivered on that day. So meaning that, you know, that's all you did was community vocab for that day. If you were doing a combination of things where it's combination of vocab and ADS in the community, or you're doing part of the day in community, part of the day in facility, you're going to have to 15-minute bill both of those services for the day, or all of those services for the day. Your billing code rates for that, it's going to be very similar to the community day hab. It's going to be the AVU, FVU, or SVU. Oops, you know what, I have a typo on there. Cross out that little D. We'll have to take that little D out. Jennifer, I don't know if you're sending the PowerPoint out to anybody, but we want to take that little D out. The self-waiver should just be SVU. Lucas and Ottawa County daily rates, again, you're going to be the same as what the community day support was, the 125, or I'm sorry, 128.25. And if it was delivered in Wood or Lucas, or Wood or Fulton County, I'm sorry, it'd be 126.75. So again, it's that same rate structure of what the community day program was, but it's just using the codes that are for the voc habilitation. You can go ahead to the next slide. Okay, then we've got the 15-minute billing. So the 15-minute billing would have to be done if the provider delivers less than 5 hours or more than 7 hours of service to that individual on the calendar day. So you're looking at all services that they would get related to day programming. The individual qualifies for, and the provider elects to bill, the behavioral medical add-on. You'd also have to do the 15-minute billing if there were multiple modes of services. So if you were doing some day hab in facility, some vocab in the facility, some vocab out in the community, a combination of vocab and ADS on the same day, you're going to have to 15-minute bill those services specific to the actual service itself. And then again, the codes are listed there, the AVT, FVT, and the SVT. And then the rates for that are going to be the same as what the community day support is, where it's the 513 per unit or the 507 per unit if you were in Wood or Lucas County. So the key to really the billing here is going to depend on what service type are you delivering, where are you delivering the service, and how many hours of it, and whether or not there's the add-on. So you got all of those factors you got to look into it. But you also want to make sure that if you're in a situation, you need to be able to determine, is it appropriate for the daily rate or is it appropriate for the 15-minute billing? And to do that, you're going to have to make sure your documentation supports it. You can't just go in and bill the daily rate, but yet your documentation shows that they were in the community and in the facility both. You're going to have to make sure you keep clear documentation, as well as making sure that you're keeping documentation of the individual start times and stop times to the services, or how many units and hours did they do of each of the different services when it falls under that 15-minute category, because you're doing different modes of services. So it takes the documentation to determine the billing, but then all of it's really going to go back to what Erin has. It's also got to be authorized in the ISP. If you go out and do community activities that would meet the rule of the community vocational or community day program, but it's not authorized in the ISP, you can't bill it. So I think that's pretty much all that I have, Jennifer. I think that was the last of my slides.
Thank you, Rita. Does anyone have any questions for Rita? I don't see any hand raised. So we will then go on to Sarah Milliman, who is the Chief Executive Officer of Riverview Industries. And hopefully we can all just bring this all together and she can tell us how a provider can make this happen. Sarah?
Hi, all right. Well, thanks for having me. And if I freeze up or do anything weird, please put it in the chat or let me know and I will switch or move closer to the whatever it's called, modem. I don't think that's what it's called anymore, is it? I don't know. So, okay. So to me, this community integration billing is the best thing that has come out of COVID. I have been a huge believer in community integration for a long time, in not doing it in groups, huge groups, right? Because, you know, when you go out and have meaningful, wonderful connections with people, it typically doesn't happen in a group of 10 or more. It usually happens in those small groups when you can interact, get to know people, and you're not just all arriving in a big bus. So this is something that I very much believe in. I think many providers have probably been doing this for a long time, just maybe calling it something different. And now there's finally a billing mechanism that supports it. So yay, yay for us. So some of the things that we do, so I started off, we started off kind of twofold. During COVID, we were looking, or prior to COVID, we were looking to expand. Our main facility is in Ottawa County, and we do lots of supports out that way, Erie, Sandusky County, but we were looking kind of to expand out towards more Lucas and Wood County, and see what we could do there. So this was like in the middle of COVID that we were like, okay, let's just do something community-based, and let's find a way to do it safely. And actually not getting together in like a large facility seemed a lot safer than doing that, right? So what we typically did was we were able to look at people who would benefit from doing more in the community. We had a group of young guys to start out with who wanted to rollerblade, like, or ride their bikes for like 5 miles, which is not, you know, rollerblading for 5 miles is not on my living my best life list, right? But it was for these guys. And so they did a lot of things, like we volunteered at the Metro Parks, volunteered at the Toledo Zoo. We did, they did exercise, some Y memberships, like everything that we could do, a lot of outdoor stuff. It did start in the summer. We attempted to do a lot of outdoor stuff, as there was a significant amount of concern with COVID during that time. So from that, we really did morph into something a little different. So what we try to do when we're scheduling these groups, or when we're doing these groups, is put people who are interested kind of in the same things together, right? I'm not going to put someone who wants to do pottery with someone who wants to look into a basketball team or something like that. So we really want to make it very personalized. We want to look at people's ISPs and see if this is something that's going to support them. I could make the argument that community integration is appropriate for the majority of people we support, right? But just having that conversation with the whole team and saying, these are some things we're looking at and what we want to do. We did then expand this program to our Ottawa County location. So something we do there is we have teamed up with an amazing little nonprofit called the Clothing Corral. It's in downtown Oak Harbor. And what they do is it's a thrift store where you don't have to pay. So every 3 months, a family can go in there and get clothes for their entire family for completely free. And it's a really, really great way to help support our community. So because we're able to use that as a VOC, community and integration, inclusion, I never know if we're integrated or included right now. So I'm sorry if I use the wrong word, but it was a really great way to give back to our community. So people are coming in there, it's open to the community. And because we're there, they're able to be open more hours and they're able to help more people. So it's a really cool thing that we have going on that I really love there. We also are trying to do more of, and I should say, not everyone comes 5 days a week. We run community integration programming 5 days a week, but not every person comes 5 days a week. And so if you're looking for that, then that's, again, another conversation that you need to have with a team. I do try to work in and say, like, this is something that we believe in. RVI believes in community belonging, meaningful community membership. And if we can support them in this way, we plan on it, right? So, but not everyone does it 5 days a week. We have people that just do it 1 day a week. We have people that do 2 days a week, but that program is open 5 days a week. So what we try to do is really rotate people in and out of that to make sure everyone has an opportunity to get in those small groups, to do meaningful community building and to go from there. So, you know, and if you've ever met me, you know that my whole philosophy is I want to work myself out of a job. I want people to have a fulfilled life with people who aren't just paid to be there, right? As many people who can support a person that aren't paid to be in their life, the better. So my whole goal in life is to completely work myself out of a job. I know that probably won't happen, but maybe we'll get there. So that's kind of how we use it. What we do as well is we do provide the NMT at the beginning of the day and in between, just because sometimes we have really busy days. Sometimes we're going in the morning and we're volunteering at Habitat for Humanity. Then we're going somewhere else, maybe to a metro park or something after that. You don't have to do that, obviously, especially if you live here in Toledo or places with good community transportation. That absolutely fits in to the skill building, belonging, and being part of your community, right? Using some public transportation if that's an option. We don't do that right now, but we are looking, especially with gas prices right now, I'm looking into possibly working in some travel training there. No. But there's just a million different ways that you can do it. I think, you know, when you look at the ADS rule, so something that we did do is we hired a certified therapeutic recreational specialist, and the University of Toledo actually has one of the best programs for this certification in the nation, but not a lot of jobs to offer in that. So what we were able to do kind of with that higher reimbursement rate was hire someone in with the skills that could truly meet like the rule when it says ADS and therapeutic recreation is in there. We want to meet that rule, right? We want to make sure that we're doing that well. So that's something that we chose to do when looking at outside the box ideas and bringing in and doing different things. Trying to think, you know, with the rule, there is, if you're serving people maybe with some higher needs, or this was a big deal during COVID, we didn't necessarily feel like it was the safest to just use any random gas station restroom. So you do have that drop-in option if you need to eat real quick, if it's raining and you were planning on doing the park, you can jump in, you can help change, do whatever you need, and then leave again. So I think that's something that is very, very helpful, especially when we don't want just people with A acuities having meaningful community membership, right? We want everyone. So if that person has some extra needs that need to be met, then I love that option that you can just do that, change, get cleaned up, get ready to go, and move back out. And so just in looking, I mean, the tips that I have that I'm sure that most people know is when you're looking at those volunteer opportunities, you want to make sure that it's a place that already has a volunteer program up and running. So we had been approached before, like, hey, I run a screen printing business, and if your people wanted to volunteer to fold my shirts, I'd let them. And I'd be like, well, hold on, that's a little exploitation, actually. So you want to make sure that when you're volunteering, they already have established volunteer programs set up. Toledo Mud Hens have things if you're looking more even on nights or weekends. The Toledo Zoo has a great volunteer program. We have loved teaming up with the Toledo Metro Parks, Habitat for Humanity. I don't know if we've gotten into the Ronald McDonald House yet, but it's on my list. But these are all things that teach really beneficial skills, but also the idea of being able to give back to your community when there's this narrative and this myth that all you do is take or need support. It is so empowering to be able to give back. And that's what we're really finding in it. We absolutely take the time. We want people, I don't want just staff planning things, right? We take the time. Let's go to the main library. Let's go to a coffee shop. Let's go here and let's take the time to come up with new things and do our own research and really empower people to do what they love. and to get involved in the planning of it, right? Like, it's not just us pulling the strings. We really encourage people to be included in that. Now, I will be completely honest, and there are times where the people who participate don't give us feedback. We come up with stuff and then they complain about hating it, right? So then my response is usually like, well, next time, how about you throw some ideas out here, okay? This is what you get if you don't contribute. So, you know, it's really a give and take, and something that I really encourage, especially when doing community-based programming, is that people give things a couple tries before they hate them. This is kind of agreement that if you're part of the meeting, we're going to ask you to do, because when you have not been included in your community, what you're used to feels safe, and that feels like what you like, right? So if I've never been out of this room before, I really like this room, I'm comfortable in this room, it has my favorite chair, everything's good in my life. But wanting to expand that and do something more can be very scary. And it's very easy for people to shut down and say, I don't want to do this. I don't want to try it. I hate it. So I generally say, like, hey team, let's be aware that we're trying new things. Let's try and give it a few times. And then absolutely, if you hate it, I hear you, I respect you. But also, if you're coming out of your comfort zone, there might be some issues where you're going to struggle with. So the biggest thing I think would say is, like, just keep that open communication back and forth between the team, between the person you're supporting, and work on those avenues of connection and support. If anyone knows me, if you have a skill that I think is awesome, I'm probably going to say, like, hey, I have a friend who does pottery. I'm like, dude, when are you going to come do a pottery class? You have a whole studio. Actually, we'll come to you, right? So we're going to try and work on that. I just recently made a connection with Handmade Toledo, so I'm super pumped about that. Hopefully get some classes going, not just for us during the day, but for the whole community. So I think that's the main stuff. If anyone has any questions, or if I did not elaborate on something, please let me know. Yeah.
Awesome. Thank you so much, Sarah. And we kind of just ballparked the time that we would set aside for this training, but we do want to field questions. So please feel free to put in the chat or come off mute if you've got questions for Sarah or Rita or Aaron. We want to make this, you know, as educational and helpful as possible. So don't be shy. So while people maybe be thinking of what they're going to type or come off mute, I will just add, for providers in the audience, thank you for being here today. For your certificates, our Sarah Gardner will be sending out certificates for attendance. If you don't mind putting your name in the chat, and also if you're wanting a copy of the PowerPoint emailed to you, put your email address in the chat as well. That's for providers. For board staff, we will be sending this out to Rita's department and the SAS's and Kelly's department, so, and provider sports. So you don't have to put your names in. Okay, anybody have questions? Oh, now we're gonna have to field between names and questions in the chat, but we have some positive kudos that you're doing great, RVI, so thank you for that.
Jennifer, I can add a couple things here that I didn't have as part of the presentation.
Sure.
When it comes to the transportation itself, the transportation to get individuals out to the community activities and throughout the day, there is the ability to bill non-medical transportation for that. Most cases, if you're starting out at the day program and you're at the day program part of the day, and then you're going to go out for a couple hours of the community integrated community services, your transportation at the per trip rate is going to be getting that individual to and from their home base in the morning, and then getting them home in the afternoon. So the NMT per trip is going to be the part of the transportation that's tied to their home, getting from home to there to home. But yet, while you're going, if you're leaving your facility to go out into the community, then you could bill NMT per mile for that. And it's going to be billed at the ratio that it's actually delivered. Again, you got to make sure that it's authorized in the ISP. And then we would authorize that in the CPT as well. So, that is an option. And so we do have some providers, so I'm going to just use Sarah again as an example, you know, they're community based in Lucas County. They don't go to an actual facility. So they have the ability to bill the per trip to get from the individual's home to their location of where they're starting their community activity at. That would be per trip. And then if they're going to go to multiple locations throughout the day, they could bill per mile. That's going to get them from their volunteer job, the volunteer activity that they do. That's going to get them then to the metro parks where they're going to do the next activity. They could bill per mile there. And then at the end of the day, when they're taking the individuals home, then they revert back to the per trip billing. So there is that ability to build those things in. Again, you want to talk to your teams about that to make sure that it's authorized in the ISP, but there is the limit on the NMT budget though. You know, we do have that budget. So sometimes you can't always get as much NMT per mile as what you would like. So, you know, we can try to maximize it, and we do, you know, pretty good job, I think, of that, of maximizing it as much as we can. But, you know, if a provider is going to ask for 50 miles a day, we're not going to be able to do that much if they go 5 days a week. But we could probably give you 50, 60, 70 miles a week, depending on what kind of ratios it's going to be typically delivered in. So just wanted to add that in there.
And just going off that, like, I would say for providers, like, go, and this is what, like, I tell my team all the time, and they're so good at this, like, just going in with a plan and knowing what you're asking for, because that's going to save you a lot of time in your ISP meeting. It's going to save you a lot of time. It's going to save the SSAs a lot of time, like, you know, emailing Rita back and forth, and just know what you're going into. And we utilize that per trip NMT. Again, you don't have to do that, because there's plenty of ways. Like, again, if you have really good public transportation, let's rock that, right? Let's get people more independent. But there are a lot of options. And then I think too, that sometimes it's, if you're just asking broadly, right? If you're just going in and saying, like, I have these 50 people and I want them all to have one day of this community integration, that's not typically, like, I would go in and do that and be like, hey, everyone needs to belong. But we do need to be more person-centered. So I typically try and come up with the people I know that are going to be the easiest transition and start talking to that might be a good fit at that clothing corral. That might be a good fit to, you know, the person loves volunteering at Habitat for Humanity, but they don't like being volunteering other places. So again, just like go in very specifically with a good idea of what you're asking for and be prepared for that. And that's just going to make it a lot easier on you, excuse me, and on the entire team. And don't be afraid to ask, you know, like, I think that we, you know, if we're offering these things, they need to be promoted. People need community belonging. So definitely explore it. Feel free to email me if you have any questions, or, you know, reach out to anyone on this thing. Cause I think, you know, for me, like I said, my daydream is that someday we have a discovery for community belonging instead of just employment, right? Like that's where I want to go in life and make that happen before I leave the field. But this is a good stepping stone to that, and people need to belong, and the community, more than them needing to belong, the community needs what people with disabilities offer them. So
awesome. Thank you, Sarah and Rita. Any questions or comments from the group? Or Erin or Kelly, was there anything that you thought of that you want to share? I know we covered a lot.
I don't have anything I want to share. Just thank you all for attending and willing to make this happen. It's going to make a huge impact. So.
Awesome. Thank you. Okay, well, it sounds like we've covered a lot. There aren't questions now, but like was mentioned, feel free to reach out to any of us if questions arise. I'll be sending out the PowerPoint to those of you who added your emails for providers, and look for a certificate of attendance from Sarah Gardner. We appreciate you being here. This has been recorded, so you can email me, jwolf@lucasdd.org, to request the link if you would like to share it with someone. And I'm ready to wrap up.
Jennifer, can I ask a quick question?
Yeah, go ahead, Sarah.
Okay, sorry. I was privately chatting. I don't know the person named Franny. You have that on your screen and you didn't put it in chat, and so I needed to know.
yeah, if you want your certificate, let us know the name to put.
Yes.
Put it in the chat so we can put the name on the certificate and email it to you.
Yeah.
Okay.
Thank you.
All right. If no other questions, thanks for coming. You dismissed, and we hope you have a great day. Enjoy that sunshine out there. Thanks for coming today.